Good evening and welcome to the Healthy Debate. My name is Lindy Naughton. Our aim with this programme, produced by Health Freedom Ireland in conjunction with the Irish Inquiry, is to promote debate on issues relating to health in Ireland. We would like to make it clear that we have no agenda beyond seeking to present all sides of the argument so that you, the public, can make up your own minds about how to manage your lives. Much of the material you will see here is not available on mainstream channels, so if you wish to support us and spread the word, of course, please press share on your screen, which I don't quite know where it is, but anyway. This week, women's rights have hit the headlines, as I'm sure we've all noticed, thanks to the brutal murder of Sarah Everard in London and the subsequent vigil and rallies all over England and indeed the world, many of them suppressed by brutal police intervention. At a protest in Dublin today, a number of activists had their names taken by Gardaí and 14 were fined for breaching lockdown regulations. There's going to be more protests, by the way, on women's rights over the next few days. Despite the many advances in the fight for women's rights, to be treated equally over the past century, the fact is that women, by and large, remain second-class citizens, not only in this country, but all over the world. And since the lockdowns began a year ago, domestic violence has surged. Women's Aid has reported a 43% rise in calls. That's the broader issue. Our programme tonight concentrates on one aspect of the fight for women's rights, the state of maternity services in Ireland and how the COVID panic has affected the process, the very natural process of giving birth. Bringing a new life into the world should be one of the greatest experiences in anyone's life, and that includes men, by the way. But has the process become over-medicalised? Are women's voices listened to? Has it got worse during the lockdowns? We have 4 guests with us today, and we'll start off with Seana Kerr, who's a midwife who's had a traumatic few weeks. So tell us what's been going on, Seana.
Hello, how are you? I'm honoured to be here. I'm delighted to be asked to be here. I'm a midwife, a recently resigned midwife, and the backstory that took me to resignation will take a wee while, but
Where are you a midwife, by the way?
In the north, I was a midwife in Southern Trust in the north, the 5 health trusts in the north, so I only ever worked in the one. And I started my career in 2004 as a direct entry midwife, so not nursing, just straight in to do your degree in pure midwifery. So we were a new concept at the outset, so as direct entry midwives we had a hill to climb because we were more mature students, most of us had life experience, some of them had degrees and that before they went into their midwifery. So we were always quite vocal from the outset, which was new within the NHS. So I personally always had a bit of resistance because I challenged everything, and there was a lot of what I seen even as a student that I felt wasn't quite right. It didn't sit well with me, but in those days I wouldn't have had enough evidence or enough courage to speak out about it. So over the years, I witnessed the medicalisation of childbirth and what it was doing to women and men and families. It's not much as I'm very much an advocate for women's rights. I believe, particularly during 2020, that daddies' rights were shot to pieces. Mm-hmm. And we have to advocate for daddies here as well. It's the family unit, it's the mother, father, child, and it has all been impacted on by maternity services in general, but particularly in the last year. And I think we were just talking earlier, the impact, the potential impact of what's been happening to families at this time is immeasurable, I believe, My concerns that took me to now not having a job were about vaccinations and pregnancy. Now, this started way pre-COVID. This started in October 2017, and I was working in a maternity assessment unit. It's like an A&E for pregnant women. People just walk in, well, yeah, they ring up and walk in, but it's a great training ground for students as well, because you have to think on your feet. You know, whatever someone's coming with you, you have to be responsive in the moment. So I had a wee mummy come in to me that I already knew, you know, from a previous pregnancy, and she was in her 3rd trimester of pregnancy, and she had come in to tell me that she had no fetal movement that day. So that automatically is a red flag for me, and I get in my gear, right, come on, tell me about what happened, and were you sick? Was there anything that would trigger this reduced movement? She said, I had that vaccine this morning. So now this would have been a flu vaccine in pregnancy. And because most ladies fall into 2 flu seasons, they're offered the flu vaccine twice. And that's where the risk becomes even greater. The risk is much higher with the 2nd flu vaccine in pregnancy. I didn't know all that at the time, but I do now. So I asked her, she seemed reluctant when she was saying, I got that vaccine yesterday. I thought I sensed reluctance, you know, and I asked her what that was about. So she told me she had been contacted 3 times to come in for her vaccine. She tried to explain that she'd had one in early pregnancy and she didn't really want one, but she reluctantly went for it that morning, and when she came into me, her baby was already gone. So she was late pregnancy, very late pregnancy, and that baby that story has stuck with me, you know, and that's what drives me forward. But at that time, what I noticed as a practicing midwife and as a mother myself, I realised the extent of the paperwork we have to do when a baby sadly dies, and all these questions, you know, was the mummy black, white, fat, thin, rich, poor, religious, everything. But they never ask, was this mother vaccinated? It's not in the paperwork for the coroner of the country. So that was what troubled me. I thought, you know, given that certainly myself and the mother thought that vaccine might be something to do with the fetal demise, you know, and we can't say it was or it wasn't without evidence. But if we're not gathering the evidence, how are we going to know? If they're not even entertaining the vaccine as a risk factor, how are we going to know if that's what harmed her baby? Now, in one particular case, I know that the postmortem found nothing wrong with the baby. So if that has found nothing wrong with the baby, then vaccine damage has to be entertained as a potential factor. But I have taken that to the coroner of the country. They weren't very impressed with
This
me.
is in the north, though.
This is in the north, yeah.
So so go on. What's
Well,
more
I was actually at a conference in Croke Park here in Dublin in February 2020, and there was a doctor, I'll not say her name, but she was a representative from a pharmaceutical company, and she was promoting vaccines in pregnancy. So I was in a room. There was myself, another few midwives, health visitors, you know, there was a doctor from Queen's. It was a multidisciplinary room, and she was doing her presentation about these 5 new vaccines that were coming in pregnancy. Now that triggered me a lot given my experience. So at the end she asked, had we any questions? So I always put my hand up for questions. So I pitched it to her about the baby, that the experience I had, and asked her why did the coroner not collect this data? You know, she can't speak for the coroner, but I was just asking the question. And she politicised her answer basically and left it. But a few people in the room did come and speak to me after it. I know it's something they hadn't really thought about before, if that makes sense. So I was glad that I had got another few people to think, why do they not ask the question, was this
what were these 5 vaccines?
I do you know, I can't remember the exact, because at that stage in the north we already had flu vaccine and pertussis, potentially 2 flus and 1 pertussis.
Pertussis just been coughing.
Whoop and cough, yeah.
Oh, that still exists, does it?
Yeah. No, they've recently brought that in for pregnant women. It started off with just flu vaccine. Now they're offering flu and pertussis. And again, this is the north. I don't know what happens in here. But she was speaking from a southern perspective, and she was talking about the 5 new vaccines that were going to be rolled out, you know, in coming time. So that triggered me a bit, to say the least. And I went back to work and started asking questions, tried to get other people interested in the fact that nobody was asking, you know, was this mother vaccinated? But even the word vaccines is a trigger word. You know, some people just want to walk away from you. Oh, you're anti-vax, and call you names and all that gaslighting. But no matter, we have reports out every year, embrace reports and everything, why do babies die, you know, and why do mothers die? And they ask every other question. They entertain every other factor as to why do babies die or why do mummies die, but they don't ask about vaccines in pregnancy. I can't understand it. as a research student, I know there are no vaccine safety studies done in pregnancy. For my research, I just wanted to speak to mummies and daddies, and I had to go, it was about a year and a half getting through ethics. So there's no way, you know, they don't go through ethics to do safety studies and vaccines in pregnancy. They don't exist. It's not ethical.
Well, I personally believe that most medicines are poison of some type. Good poison maybe, or bad poison. But to me, it's pretty obvious that there has to be problems.
I hear you. You know, and certainly in the last year that I've had from, I think 2020 changed most of us. I have been exploring more about the potential damage from what we put into our body, whether that be vaccines, whether that be medication, whether it be the food that we eat, you know, the water we drink, you know. There are multiple factors, and all the other factors seem to be being addressed, but nobody wants to hit the hot potato, that's vaccines. You know, you're not allowed to talk about that. You know, I don't have a job right now because I escalated my concerns about vaccines in pregnancy, you know, so why is it such a hot topic? Why does nobody want to touch it, you know?
Well, you said there about a code of conduct, stroke ethics. So you're not under the Hippocratic Oath, are you?
No, but
as nurses?
With nurses and midwives there in the UK, we have the Nursing and Midwifery Council.
Right.
So they're UK-wide. And in order to work within the NHS, in order to practice as a nurse or midwife, you need to have your NMC PIN. So your PIN number, you know, that keeps you registered with them. And then if the public or your employer has any concerns about your practice, they can refer you to the NMC. So they have a code of conduct, a 6-point plan, you know, prioritise effectively. It's about advocacy and informed consent and all those basic underlying principles that should be fundamental in healthcare. And I know I did not breach my code of conduct at any point in time because it's like the Magna Carta of my profession, you know, that's, and when you keep it to those basics, don't get embroiled in all the other stuff. Keep it to your basics. Are you doing what's right for this person in your care? Are you asking them what they need? Or are you trying to tell them what you think they need? So much of healthcare, I find, is prescriptive rather than responsive, you know, and I think that's where the gaps fall. You know, people are being told what they need instead of being asked, what do you need?
Well, this is the whole point of our programme here, by the way,
exactly.
So that people can make up their own minds.
Yeah.
I have a note here, in her shoes. What on earth does that mean?
Oh, in her shoes. Last year, I spent quite a bit of time off work, sick last year because of bullying in midwifery is rampant, unfortunately. But anyway, I took some time out to get myself better again, so I was doing a lot of research on my own, and Facebook was great for giving you signposts to other places, and there was a group based in the south of Ireland called COVID Pregnancy in Her Shoes, and we mummies and daddies were sharing their stories almost on a daily basis at times of the impact that the restrictions were having on their birth experience. And like I say, like we were talking earlier, you know, the potential long-reaching impact of what's happening during the pregnancy are immeasurable. You know, the pre-birth experience for the baby, never mind the mummy and daddy, is the foundation for their future, you know. And if their foundations are so wobbly because of restrictions and inductions, and some wee mummies are sitting in rooms being told their baby doesn't have a heartbeat. And I've been that mummy twice. And their husbands or partners out in a car park. And then they're having to go out. And the wee mummies were sharing these stories every day. It was heartbreaking.
So we're going to move on to Leemore in a minute, who's a doula. But could you just explain what is going, if somebody is pregnant now and going into hospital, because not all of us know.
Yeah.
But what happens now? Mm-hmm. You have to get a COVID test, I assume.
Well, funny you should say that. I haven't been on the wards in quite a while because I'm clinically mask exempt. So the place where I worked wouldn't allow me to work with patients. I did offer to wear a visor, not because I thought I needed it, just because it was a conciliatory gesture, I suppose, but that was declined. So I can only speak from what I'm aware of, and I am aware of. I have a lot of friends still there. COVID testing within a hospital is Where do I start here? A friend of mine had to get an OGD. Do you know an OGD? A camera down her throat. I know this is slightly separate from maternity, but I'll explain it.
No, just what it's like going into hospital
Yeah.
now. It must be horrifying.
Well, so she gets her letter out for her OGD, her official letter, but she had this other letter on top of it. You must get a COVID test, you must this, you must that. And I thought, that's not a discoverable document. So I brought it to their attention. So the letter she was getting for her appointment is as it always was, but the letter she was getting to have her COVID test was on a poor photocopy. No version number, not written. Now, this is just where I live, not registered. So in 30 years' time, if you go into that lady's notes to find out why she had a COVID test, it's not going to be there, because her letter for the doctors is a normal standard template letter. And that was what made me more aware that there was more to this than it seemed, because the requests for the tests, which weren't requests, you must do this, you must do that, they know that that's wrong. You can't tell someone you must do, or you can't have your treatment until you have this test, because that's blackmail, coerced consent. But they're doing it in a way that it's not going to be discoverable in the future.
So the COVID tests, so you go in, if you're having a baby, do you have to now wear a mask, and all the medical professionals?
Well, they're being told to have to, but again, that's down to consent. If
Is it
they
in
could tell
every
me
hospital?
I have, they are asked to. They are asked to, yeah. I know some people decline, but they are then put down as declined. You know, it's like vitamin K for babies. If you decline your vitamin K, they'll go and get the paediatrician to ask you, are you sure? Are you sure? You know, what's it?
To scare you.
Yeah, coercion.
Actually, that's what we'll bring Leemore in here. Leemore is a doula, which I think you better explain to the public what that is, first of all.
Yeah, so doula is a word that comes from Greeks. It means mothering the mother, or a servant to the mother. And I'm supporting women during pregnancy, birth, and postnatally. And I'm also currently studying to be an end-of-life doula. So I would support families in end of life, to support for the family and to the person that's dying.
So what is this? I know this sounds a bit weird, but is this a qualification, or is it just something? Do you know what I mean?
Yeah, it's not a degree.
Do you go to school to learn how to be a doula?
You learn for many years and with experience, but I think in many ways doula is a calling.
Yeah.
Okay, and then you go and study and study and study, and we have also CPD days, and the more you study, the better you become. I think the more experience you have, the better you become. So
how do you work?
Now I am not supposed to work for the last year.
Well, tell us what's been going on then.
So,
and please interrupt at any time, Seana.
Yeah.
Don't give me that leeway.
No, I'm like, we're loving the together that we're having here, don't we? Yeah. So for the last year, doulas are not allowed to go into, well, I can speak about Dublin.
How many doulas are out there?
In the Doula Association, I think there are about 50, but there is about 50 more or maybe 80 more that are not a part of the Doula Association of Ireland. And there is plenty more in the north. Mm-hmm. Okay. Right. We've been working very hard for the last 14 years to get some kind of relationship with the hospitals. We have, in the Doula Association, I can say, we have processes and procedures. And as we talked about, we have to have GARDA vetting and so loads of paperwork. Yes.
Great one.
Loads of paperwork, and it was never easy to be. I can speak for myself. I'm not speaking for the Doula Association or anybody. I'm speaking for Leemore Blitzblau Butler. I would always go in, taking a deep breath. It's like you're going for a big dive.
It's the same when you're a midwife, believe me.
Yeah, I believe you.
Do you mean going into a hospital?
Going into a hospital.
Are you allowed in?
So you have to write in a letter.
At the request of your patient?
The patient is bringing a letter from me saying, this is my doula, she's going to be accompanying me or us. Before COVID, I would go with couples, okay? Mm-hmm. Since COVID, we were allowed, and I've been accompanying into the hospital mothers as a birth partner. Right. So, for example, let's say I had a lady that I was with her 5 years ago in her birth, and she never wanted her partner with her. She wanted another woman to be there for her.
It's becoming more popular, actually.
Yeah. And obviously she had a few miscarriages, and then she got pregnant again. The second she was pregnant, she goes, I'm pregnant, and I'm booking you for 9 months time. And then COVID happened, but obviously I went in with her. But, for example, this is a fantastic story to share with you. This lady was 40 weeks. She was big. She's a big woman, much, much taller than me. I'm only tiny. And big baby, and she was told she was to be induced. So induction can take many different ways, but it's a process. It's a process. And
Cascade of intervention.
Totally, a cascade of intervention. And when you're going in, you're on the clock. So the minute you administer one thing, you can be with that thing for a certain amount of time. Okay, so they insert something, you can be with it for 12 hours. Then they check you again in 12 hours. Then they break your water. Then they give you Syntocin. If you get Syntocin, you probably get an epidural. If you get an epidural, there's a possibility it's going to end up with a cesarean birth.
You're on a CTG monitor the whole time.
Yeah.
Yeah.
Now, unfortunately, I think, again, I'm speaking for myself. I think it's human criminally. Okay, I really think it's criminal what these women are going through. So this woman had to walk in on her own into the hospital. You're not allowed to have a partner unless you're in the delivery suite and 5 centimeters dilated. She was on her own from 8 in the morning. I touched her and held her at 10:45 at night. And all that time, from 8 in the morning till 10:45, so it could be me or her partner, sitting with her on the phone. She is screaming on the phone, and I'm trying to support her on the phone. They broke her water, and all the water was on the floor, and she felt dirty, and nobody was there to help her. Nobody was there to hold her, to hug her, to tell her that she can go through it.
Where were the nurses?
Well, they're very, very, very busy because there's no partners.
But what are they busy doing?
Yeah, exactly.
What are they busy doing? I often hear that on the ward, especially from postnatal mummies, the midwives were too busy to help me with breastfeeding.
Yeah.
And I'm like, what are they busy doing?
Yeah.
Because breastfeeding is the most important thing they should be doing.
Seana, and you correct me, okay, if I'm wrong.
Go ahead.
How much paperwork do you have to do?
Yeah, I hear
How
you.
much paperwork do you have to do? Instead of watching the person
Being
that's with you,
yeah,
and then right afterwards, whatever happened or whatever, you constantly have to write stuff down, and you constantly have to monitor many different machines. And it's like, when I saw you, did I go like this, right? Because it is inhumane what midwives have to do also. The pressure that they're under is, it doesn't make any sense.
But can I stop you there just for a second? Because I hear you. I hear what you're saying, and I understand why many staff fall into the trap of all the paperwork and everything else. But given that one of their primary roles is an advocate, they need to be raising concerns. If I'm in a room and paperwork is taken over looking after the woman, that's concerning, because the woman's the most important thing in the room.
Absolutely.
So
I agree.
you should be managing your time. The paperwork can wait. The mommy is in labour, the daddy is terrified, and the baby's hoping we're all going to work together,
Yeah.
So while I understand the pressures of paperwork, believe me, I do, as the advocate for the person in your care, you have to manage that. It's
But
your
don't
problem,
you think,
not the mommy's.
Don't you think that when you're a part of a system like that for so long, it's much easier for you to forget your calling and to just...
Of course. I
Tick
paid for
boxes.
that. Yeah.
But
boxes.
this was clearly a problem before COVID anyway.
Oh, absolutely.
Yeah,
Absolutely.
Yeah.
And so what I was saying is that as doulas, we always found it hard to come into a room.
Yeah.
But
because-
that woman, by the way, before I forget, did she want a natural childbirth?
Yeah. So
Okay,
she
yeah.
wanted a natural childbirth, okay? By the time I touched her, I held her, she was, the only way I can describe it, she was in hell.
Yeah.
She was in hell. The suffering that she was under was inhumane.
Where was her
okay?
partner?
Or he was at home with the other baby. I was her partner.
Oh, I know that, but I mean, he must have been affected by what was going on too.
Of course, because she was between calling him screaming on the phone, calling me screaming on the phone. Okay?
That's barbaric.
It
That is
it's
barbaric.
Really, I really think it's horrific. Okay.
Do you know what else? Sorry for interrupting. What troubles me most about that is I have friends who have children in their 30s, and they can still recount their birth stories in vivid detail.
You know that women in their 80s and 90s remember their
and
birth story.
daddies, not just women, mummies and daddies,
absolutely.
because daddies have a whole different perspective on it because they have a whole different angle because their partner is in all this pain and
I
trauma
agree. I
and
agree.
their baby, and they're feeling completely useless as if they can do nothing about it.
Yeah.
They're completely disempowered.
Yeah.
And some of them are sitting at home
Yeah.
because they can't even be there.
Yeah.
It's barbaric.
I have a few other stories. I have a holistic center here in Dublin, okay?
Mm-hmm.
And my center is like a red tent. You know what's a red tent, right? A red tent is a place that women support women.
Mm-hmm.
And I've been supporting families in the making for many, many years, okay? In my tent, I would teach also baby massage. I would teach antenatal classes. I would teach pregnancy yoga. So my center was buzzing and extremely, extremely busy before COVID. Okay, the minute the first restrictions came, it was very quickly. You can only have 5 people in the room, which means you can only have 2 mommies and 2 babies, and I would have 10 mommies and 10 babies. So a mom and a baby is not considered one unit. They're considered 2 different people, even though they breathe each other constantly. You know, I had mommies in my center in June. I had 4 ladies, and I brought them their coffee and their biscuits, or tea and their biscuits, and they were sitting and crying just from being in a room with other women that had babies, so they can talk about their stories about how it is to be a mom, the normal hardships of being a parent, you know, which now completely shifted into another level of hardship.
But this, you may know more about this. A friend of mine was saying to find out what was the aftercare for new mothers.
Yeah.
That when her 2 sons were born, over 30 years ago, there was classes for. They were taught how to breastfeed.
Absolutely.
And they had
But now we're not allowed. I'm supposed to do that stuff in Zoom. I cannot do that stuff on Zoom. I need to touch my women. I need to touch the babies. I need to show you how to breastfeed. I need to show you how to hold your baby. I need to show you next to me. I need to see you. I need to smell you.
But when my eldest daughter's 27, and when I had her on a Sunday, and I didn't get out of hospital till Thursday.
Yeah.
So by the time I got home, and I wasn't even a section with her or anything like that, by the time I got home, I had my breastfeeding off to a good start. I could change a nappy quite quickly, you know, and you were learning all these new skills that were very much as I'd always been in touch with babies. This one was mine. That was different. And I believe that first-time parents especially need that critical care in those.
Totally.
Because once you teach them with their first, they can bring it on to the next one, you know. But I have, just when you're saying about the red tent, I have recently set up a thing myself. It's called Care Plan, because whenever I was in working in hospitals, they always had a care plan, box ticking exercise. Have you peed? Have you pooed? Have you eaten? Blah, blah.
Yeah.
But it's back to that prescriptive care plan where they were telling you what boxes you tick. So I believe in a more responsive care plan. So that's, I'd say we're working along similar lines. You know, I'm just trying to support families to parenthood. But one very interesting thing that has come up, and just because we're on the subject there, one of the daddies, I have a few parents and groups in my care at the minute, and one of the daddies came to me and asked, could he speak to me alone? And I thought, yes, brilliant actually, because he didn't want to express his fears in front of his partner, but he had a lot of questions.
Yeah, so we do. I have a friend here, but there's actually great stuff happening this year for daddies, and I would send my clients also for daddies classes. Absolutely. Like a birth preparation, but especially for dads.
What I don't understand is I've a relative who was a physiotherapist in the Rotunda. Not sure, I probably shouldn't be mentioning hospitals, but her job was, she was her specialist area was dealing with new mothers.
Yeah.
That was
From
her
a physio
job.
point of
Of
view, yeah,
course.
yeah.
She went in and did physio with them.
Of course.
Post-section and
Yeah,
post-traumatic delivery.
But
yeah.
also, as we all know, that the midwife visited the new parents. And this is the thing, I think in Ireland, I think
Some
in
do.
the
In the
UK,
south,
Some
in
do.
the
three
south, they
visits.
have the public
That's
health
what-
nurse now. In the north, it is slightly different, and there's much better aftercare in the
Yes,
community
that's
in the
what I was
north.
wondering, yeah.
We have community midwifery, and they would go to houses again.
They go to
Triage.
houses also here now.
Oh,
I
do
know.
they?
Yeah,
Yeah,
they
that's
do.
good.
They do. But that's still not enough.
Oh no, it's
You know,
absolutely.
you know, especially like I'm in contact. I was telling you, Lindy, earlier that I'm in contact with a lot of foreigners, being originally a foreigner, not for the last 24 years, but yeah. But I am in contact with a big group of people, and you know, especially now, the families cannot come and support them.
Yeah, and
You
they
know?
depend on family
and
support.
that again, that is not natural. When you have a baby, this is one of the reasons I created my center. Is when I had my firstborn, actually this month, 17 years ago, I felt that being a mother is one of the most loneliest times in woman's life.
Can be, can be.
And I thought it's because I was a foreigner. It took me a long time to understand. You have loads of people from Donegal, from Limerick, from Galway, who came to work in Dublin. So they don't have their family support close by. So you don't even need to be from a different country. You just come from a different county, and you don't have your family support close by. And that can be really, really hard.
I only moved from Lurgan to Newry, and I felt like a foreigner, believe you me.
Voila.
But can I just pick up on something you said there brought me back to a lovely wee story. So am I okay to?
No, I'm just wondering, at what point do we speak to Leor?
Leor, I don't know. Yeah, let
Will
you
we bring
guys
in
know.
Leor? Are you there, Leor? Leor?
Yes, I
Are you
am.
there?
Here
Hi.
she is, smiling.
Could you unmute yourself, Leor, please?
Yeah, I'm unmuted.
Can you
We
unmute
cannot
yourself?
hear you.
We can see you, but we can't hear you.
But I'm unmuted.
Can you hear us, Leor? Leor?
We can hear
I
you.
hear you.
What's going on, folks?
But can
Hold
I
on.
just
Yeah.
pick up on that what you were saying, just we're getting to sort that out about family support. In the north, while we have many groups of, the different communities, one incident that stuck with me, and it happened in January 2005 because it was the anniversary of my first son was stillborn, and he would have been 10 that week.
Yeah.
And I was a student midwife, and we were working, and we had a wee couple in, and they were from the travelling community in the north,
Wow.
a wee mummy and daddy, very young, and it was their first baby, and their baby, had passed in utero, so I was in labour ward with the real midwife and the wee mummy and daddy. And I don't know what your experience is here, but whenever anything's happening within the travelling community, they come from everywhere.
Voila.
It was beautiful. It was
Yeah.
beautiful because,
because
they
that's
all
what
came
support
to
is.
support her
Yeah.
and him. The wee daddy was collapsing, bless him, and his friends were literally carrying him down the corridor. My heart was broke. But some people were giving off because all their cars were outside. I was like, they need to be here for this wee mummy and daddy. They've just lost their baby. And they all came and they prayed with the child, and they
Yeah.
all held the child, and
Yeah.
and it was beautiful.
Yeah.
And that was pure community.
Yeah.
That was the way when I grew up in the north in a council housing estate in the 70s and 80s. We done that. When somebody died in our street, the whole street pulled
Yeah.
together. When somebody was married, the whole street pulled
Yeah.
together. That's community.
I think community is
Yes.
one big thing that's broken now.
Absolutely.
And doulas and midwives should be the one
working
community.
together. They should be
Yes.
working together.
Yeah,
Absolutely.
Totally.
But I understand the resistance you would get because
Right.
I've been there.
Right,
Oh, but, yeah.
Leor, can you hear us now? Can we hear you,
Yeah.
rather? Right.
Can you hear me?
Yes.
Yay.
Go on, tell us your story.
Hi.
Okay, so I'm a first-time mom, and I was lucky enough to have Leemore as my doula. As you can hear, I'm a foreigner, so I wanted to have someone from within the system to help me to understand how the Irish system is working. So I immediately contacted with Leemore. And the thing is, as she said, we don't have family here at all. And I was really afraid of giving birth. I have a previous trauma from a previous surgery that I had. And I was terrified going to the hospital alone to all the checkups. I was like staying awake at night before every medical exam I had. And it was terrifying. I remember that I think the 8 months before giving birth as a total hysterical time with a lot of crying, not sleeping at night. And even with Leemore supporting me, it was very hard not to have my partner with me in all the exams, not understanding medical terms. All the doctors are with masks on their face, so you can't really read their lips.
Yeah.
And you Irish people are speaking really, really fast. So it was really hard for me. And then with the advice Leemore gave me, I told the medical team that I had a trauma from hospitals and from doctors. And they were actually really great because they let me have a lot of conversation with the psychiatric team in the hospital I was registered in. And finally, they let my partner in for the last month to all the exams and to the birth, like the time before birth and the birth itself and the post-natal care. And the thing is that
like he didn't leave her for a second. Nobody touched her without him being there. But Leo, what I want to ask you is, do you remember you said to me, I watched on TV this mother that had twins and they didn't let her partner be with her. So how would they let me have my partner? Do you remember that? Mm-hmm. And I said to you that, do you remember?
Yeah, that I need to try, and ask. And what, like the worst scenario is they will say no and then we can handle that. But the best case scenario is that they will let me have my partner beside me.
Yeah.
And this made the whole experience a lot more easier for me and a lot less traumatized for me, because not having my partner is a big deal here as a foreigner, as someone who has trauma, and as a first-time mom, definitely.
So did you have the baby? I presume you did.
I did 6 weeks ago, yeah.
Boy or girl? We have to know.
Girl.
What weight? I know the right questions. I have two young friends that have had babies recently, so.
She had an amazing birth. She's an excellent birther.
All right, okay. So
but I just want to say that it's all because of having Leemore and my partner. The thing is that when I'm with the anxiety, I can't think straight and I can't answer questions and I can't speak English properly and I can't understand English properly. So having my partner in all the last minute exams before giving birth, he was the one asking all the right questions. He was the one that advocating for me what I wanted to know and what I need to know moving forward. And without Leemore advising me to do it, I would never even ask if he can be, regardless of my trauma.
Where are you from originally, if you don't mind me asking?
From Israel.
Oh, right, okay.
And for us, it's really...
That's a real conversation stopper, isn't it?
It is, yeah.
Sorry.
For us, it's really funny because like in Israel, everyone is vaccinated against COVID right now. And I'm here without my family, without them being able to come here or me being able to go there. And it's such a crazy time. And I think you talked about postnatal care. Leemore has been in my house for the last month, I think every other day, helping me, feeding the baby, giving me time to sleep because my husband is working, obviously. And I was really afraid of having a postnatal depression, which Leemore also knows about it. And the only way I'm smiling right now is because I have her, I have my partner, and I also have the support of the hospital I was in because they are still having a checkup on me to see if I'm doing okay. So a big thank you for them as well.
Right, so that's a good news story.
Yeah.
That's good, isn't it?
And that just shows you the beauty of effective support.
Yeah.
It doesn't. It's not rocket science.
Yeah.
Just care about people.
Yeah.
Just funny you were asking earlier about qualification. I have to say, for what I'm doing with the care plan, the people I want working along with me are people who actually care.
Yes.
It's not about. I think a lot of people go into the health professions for a status. I'm a this, I'm a that, or whatever, and they forget to care about the people in their care. And that's the fundamental thing.
Yeah, but I think what you're saying about paper, I won't go on to my usual hobby horse about all the middle management people.
Oh, yeah.
But the paperwork thing is a nightmare. The
I
people aren't
believe
able to do their own job.
I believe it's distraction techniques, but we'll not get into that.
Right.
I believe the medicalisation of childbirth has ramped up in the last 10 to 15 years.
Yeah, that's what I was wondering. At what point did it change?
Well, I know my youngest will be 18 in August, and at that point there were no vaccinations in pregnancy. I wouldn't have taken them anyway. But
yeah, mine. I had two. I have a 17-year-old, a 15-year-old, and a 9-year-old. But I had two in the hospital, and the last one was a home birth.
Right.
Because I didn't feel safe in that system.
Mm-hmm.
But that's the other thing, of course. You were saying to me that there's a lot of traumatised women out there who just don't want to go to hospital at the moment.
Yeah, so I was also this year a part of a story of that was just one of my stories, that a lady, she was so traumatized going into the hospital constantly, and she decided at the end to have an unassisted home birth. Which, if
Free
you really
birth.
think about it, it's like that she felt safer on her own without a midwife or a doctor, anybody, just herself and her partner, to have the baby at home alone because she felt so unsafe and so unheard.
unheard. It's finding their voice within the hospital. Yeah.
And I think also that a lot of the traumas that women have, we're not going to get into the postnatal depression. I think a lot of the time is post-trauma, and it's not being talked about. And I think the main trauma is when you feel you're not being heard, that things are being done to you,
Yes,
so
without your
they're gonna say, I'm just going to check you, okay? That's not an informed consent.
That's not consent. But I will also step in for the daddies there again.
Thank
Believe
you.
you me, daddies are traumatised by birth.
Absolutely, I agree.
Even maybe a birth that the mummy's not traumatised by, or the midwife's not traumatised by, the
Absolutely.
daddy can be very traumatised by it.
Absolutely, I agree.
And the baby.
I can just share a small story from my birth.
Yeah.
Of course.
So, from 6 weeks ago, when the part of birthing the placenta was happening, so the midwife told me, okay, we're gonna inject you the injection to get the placenta out. And I was so confused because I was just like giving birth and my child was on me. And I looked at my partner and I was like, I don't know, what shall I do? And he was the one asking the midwife, is it really necessary?
Yeah.
And she told him, well, it can take 15 minutes with the injection, or about an hour without. And he looked at me and I was so confused and so tired. And he said to her, okay, what are the side effects of this injection? And she told him it can cause nausea or
Vomiting.
Excessive.
vomiting, yeah.
Yeah.
Yeah, and then he looked at me and he said, well, you gave birth without an epidural.
And
So
how
I
long
think
were you in the hospital? You have to tell them. How long were you in the
1
hospital?
hour.
1 hour.
That's all?
She arrived completely dilated. She would,
Pregnant?
yeah.
The first time mom?
Yes.
Wow.
Yeah, so we
because I
did
was so
amazing work
afraid
at home.
Right.
Yeah.
I
Okay.
was so afraid of getting to the hospital, and this is why I postponed getting to the hospital.
Yeah.
Right. Well, we've got one final guest, who is Kathleen Allen. Are you there, Kathleen? Have we got?
I am. How are you?
Oh, Grant, we can hear you. Good. Have you heard what we've been talking about there? Have you heard it? Have you been?
Yeah, I have.
Yeah, Grant. Well, can you tell us your story, please? It's to do with PCR testing, I know, basically, isn't it?
Yes. The dreaded PCR test.
Exactly.
I had to have a routine PCR test because I was being admitted early. I had a few complications on my little boy. And I went up, had my PCR test, and I got a text message, I think it was like the next day, that I had tested positive for COVID. So I rang the hospital to find out what I was to do and figure out what they were going to do with me. And they said, look, we'll prepare a room for you, because this was on the Friday that I got the confirmation, and I was due to go in on the Saturday morning anyway. So they said, just ring me when you get to the hospital, and rang when I got there, and oh my God, that's when the show started. Is all I can describe it as, was a show. They came out to me in full PPE. I instantly felt like, oh my God, I'm so embarrassed. I was so embarrassed because they had to take me from the car. I wasn't allowed to get out of the car and come up to the door or anything like that. They just collected me, strapped a mask on my face, and walked me in. I had to take a separate elevator, which was a COVID elevator, and they brought me to a room where they had all the machines and stuff like that, and I basically ended up being stuck there for 10 days. But in the meantime, we were trying to pull my section forward, because I knew I was having a section. I had gestational diabetes, and my little boy was basically not head down, and he was transverse, and he wasn't playing ball. So they were kind of concerned, just if I went into labour, that the cord would drop first and he could get into some difficulty. So we tried to pull my section forward. To be fair, the midwives were very, very good, and the doctor I dealt with. And then I got news from one of the higher up consultants. She came into me and she said, well, actually, we're actually going to delay your section. And I was like, what do you mean delay? Because he was due to be delivered on the 21st and no later, which was 39 weeks. And because of the dangers and the complications, it was better to have him delivered sooner than later. And they said, no, you tested positive for COVID, so we're just going to wait, basically, until your COVID is gone, another week. And at that point, then I just...
Can I ask, just, you tested, I've heard stories of people who are in jobs that get tested all the time, and they test positive, and I've said, oh, that's terrible. And they say, oh, no, you just go back the next day and you get a negative. So, I mean, you know, were you asymptomatic? What's the story?
They refused.
What?
Yeah, they had, I asked them to retest me and they refused.
Right.
They said, no, if you're positive for COVID, you could test positive for up to a month after you've had it. And I was like, but I'm not sick. I'm here because I have pregnancy complications, not because I'm a COVID patient. You're treating me like a COVID patient. I'm not a COVID patient. I'm here for my pregnancy and the safety of my little boy. And they refused to test me again, and oh my God, it was absolutely horrific. The way I was treated for the whole week, or for the whole 10 days I was inside there, was just awful. I literally just had to go viral with the video, which I didn't intend to do. I put a video out on Facebook, just being really, really upset. I was really nervous about the safety of my baby, and the video went viral. And thankfully it did, because if it didn't, they wouldn't have reversed their decision. Because of the video and because of the attention it got, and people were ringing the hospital on my behalf, just complaining and saying it was ridiculous how I was treated. The consultant who made the decision recklessly and without even checking my chart just made this decision, just, oh, she got COVID, let's just leave her for another week. He came down to apologise to me, and they decided to do my section on the day that it was planned, which was on the 21st of January.
Right.
But while in the hospital, to be fair, the midwives are fantastic, but the treatment in general, just because of being COVID positive, was ridiculous. I had symptoms, as in I think I had a head cold about 2 weeks beforehand, but not at the time when I was tested. That's why I was actually really surprised when I tested positive. I was like, okay, I'm not sick. I'm showing no symptoms whatsoever. And yeah, it was horrific. It was absolutely horrific. just like, it's bad enough that we can't have our partners there in the first place, but to be locked in a room, not allowed to go for a walk, not allowed to
How healthy is that?
go outside anywhere. It's not. We're all healthy, and I like, I'm not a person that suffers from mental health in any way, but this really, really played with my mind. I had a camera facing my bed, so they have a camera on the wall with an intercom, so that they don't have to come in and talk to you. They will press the button, and I was numerous times woken up during the night by, Kathleen, are you okay? And I'm like, oh my God, there's this camera on facing my bed. So I used to take my mask and put it over the camera.
Good
Just
woman.
because I just did not feel.
Nice one.
I actually didn't feel right, and I didn't realize for a while. I asked the midwife, I was like, can you see me outside? She was like, oh, we press the button on the door, we can see you. And her words were, it's just to make sure that, what did she say to me? It's just to make sure that you're still breathing.
Oh my
which
God.
was her exact words. So I was like, okay, thanks very much. But it was awful. I could talk for days about the treatment up there. Apart from the midwives actually being quite helpful, the room I was put in was freezing cold. I had a draft, and I was told, oh, it's because you have COVID, like we need air in the room. I asked them to turn up the heating.
And you were on your own.
They put my baby in an incubator, and I was on my own. I was completely on my own.
After a cesarean.
There was like, oh yes, after a cesarean. So I had my section on the Thursday evening at around, I think it was like 7:30, and the next morning the midwife came in at 6:30, and she said, do you feel up to having a shower? And I felt disgusting. So
Can
I was
I
like,
ask a
I'll try
question?
and get up, but I was in a lot of pain.
Can I ask
Sorry?
you a question? Were you planning to breastfeed?
Yeah, of course.
And did you manage to breastfeed on your own?
I did. I managed up for about 3 weeks.
Of course.
Yeah, I really wanted to breastfeed this time, because on my first I just mentally wasn't able to. But I really wanted to do this time, but it was very difficult.
Obviously.
After
Can I
after
just
all of this to start.
Sorry, can I just come in for the daddies again? One thing that I can't understand about the rationale when they're, daddies aren't allowed in labour. These men generally are
together.
lying with the partner the
Yeah.
night before,
Yeah.
and they're going home to the same house. So I'm
Yeah.
like, where is the rationale behind? There's not even it's a dictation. There's no logic. There's no rationale behind it. And I actually spoke to a solicitor in the north a few months ago, but he wasn't very helpful. But I do think we can get back to it. I believe daddies should take a collective action against whoever's stopping them from doing this, because
Absolutely.
they're being denied their parental rights.
Yeah.
Just because the mother carries the child doesn't
Yeah.
make the father any less of a parent.
Yeah.
But they're treating the fathers like second-class citizens. This
Yeah.
is the father's child as well.
Yeah.
I can understand them maybe not wanting extra staff or doulas. I can sort of let them away with that. But the daddy, that's
Okay.
his child
I can
too.
tell you again, and it sound really bad, but for my foreigner daddies, much easier to turn tables here.
Reverse discrimination.
They would just
seen
come
that
in
too.
and then they would say, "What are you doing to my wife?" I had another couple this year, and the dad, I said, he was on the phone to me. I said, "Call them in. Call them. She's not a prisoner."
Exactly.
She's not a prisoner. And he rang the master of the hospital. He said, "You're letting me in now, or you're not touching my wife, or she's coming out." And within 5 minutes, everything changed. So how is that possible? If there is a medical, he shouldn't be let in. If there is a medical reason.
Of course.
But if because he's making a
There's
noise.
a lot of inconsistencies with
Yeah.
their decisions,
But just to,
it's different rules for different people, and
well, that's Ireland for you, isn't it?
I think I made a fair point. Like during the day, the way before you go in, you have to go up to the tent and get your temperature checked and mask up. If you're a partner, you leave everything at the tent and they'll drop it into you. So during the day, he'd have to go to the tent, but at night time, when the tent was closed, he was able to come into reception and talk to anybody in reception and hand in stuff there. So,
crazy.
I mean, like it made no sense. And it was when he made that point, I was like, oh yeah, I totally forgot about that. Or when they're, even when they're bagging stuff up for me to leave, they put all of my cases in these big yellow, like hazardous waste bags, right?
danger.
And then she handed me my handbag and said, carry that on your shoulder, and like, it's just, it's none of it makes any sense to me at all.
How long, just out
None
of
of it.
curiosity, how long did you stay in hospital after the cesarean?
3 days.
3 days.
Was it
24 hours in the north.
Friday, Saturday? Yeah, I was out on the Sunday. Yeah.
Is that all?
24
And you're
hours
not
in the
allowed
north.
driving all
After a
sorts. You're
cesarean
not.
birth.
24 hours. Some are going even less. Next day after cesarean.
Is this normal?
No.
No.
I've had
Right,
3
okay.
cesareans myself, and normally I stayed in for 3 days. One of them I went home after 2 days, and I paid for that. And the wee mummies are being sent home day 1, post-section, maybe
So
breastfeeding,
dangerous.
maybe
It's unbelievable.
I think it's crazy. And then the impact on the community staff, because the community staff are then looking after post-op patients.
Of course.
Community staff shouldn't be looking after post-op patients. Ward staff should be looking after post-op patients. Patients, mummies and daddies shouldn't be in the community until they're fit
Yeah.
to be in the community, But
Right, we're very close to wrapping up time. So, is there anything further? Any of the pair of you that are on Skype want to say to us?
Can I
Leemore?
actually just say that if there's any first-time mums like going in to hospital, I know for me, like this was my second baby, so I suppose I was a little bit more prepared in the sense of being a mum. But I know if I was younger and it was my first baby, I would have been terrified. If you put your foot down inside there, and if
Exactly.
if they're telling you can't do this or you can't do that, if you tell them you're not putting up with it and you're not accepting this treatment, they will back down straight away. The minute that video went up online, the doctors were doing apologising. They were trying to get me to take the video down, and I refused point blank. And after that, I had no issues with anything. They tried to get my partner to take a second PCR test. He had got one done privately. That wasn't good enough. They wanted him to get a hospital one done. And I said, not a hope. Like, no way, it's not happening. You're just going to have to deal with it. And they never said a word about it again. Anything at all for any first-time mums going in, just like, don't be afraid of them, because they're very intimidating.
Right.
Very,
my
very
body, my
intimidating.
choice. What happened to that? My body, my
May I
choice.
ask? Can I ask another question though? Because this is me being sentimental. How are you doing with the baby now? How's your little baby?
Oh, he's flying. He's absolutely flying. He's healthy as an ox, and he's just a complete joy. So, at the end of it all,
Yeah.
it was worth it. Yeah.
Grand.
A lot of times people will say to new mummies after a traumatic delivery, oh, but sure, aren't you alive and well and the baby's alive and well, as if that makes it okay.
Yeah.
And I am so, especially when I have a student, I've said, and that's not good enough. We have to take the trauma out of the
Absolutely,
process.
and process
It's not just
it.
about getting the two of them out alive. Of
And
course we
heal.
want to do that.
Yeah.
But can we get them out less traumatised, please?
Exactly.
Right, I think we're going to have to wrap up here now. So don't forget, this programme is brought to you, The Healthy Debate, as we are called, by a small band of volunteers. This week's programme was put together largely by Sarah, who's sitting over there very quietly and saying nothing. I hope there's some comments. I'm sure there are some comments coming in. And Stephen, as usual, is doing the overall producer, helped by Danny, who's our boss, really, and our two helpers, Kieran and Connor, who are now part of the whole process. So if you want to support what we're doing, I'm getting ordered here. If you want to support what we're doing financially, as you might have seen, our whole studio has changed today and it's for much the better. So if you want to support us, you don't have to, but we'd appreciate it. These things, those things, they all cost money. And so if you wish to support us, you can do so via the Irish Inquiry website. And if you have any comments, if you have anything you want to say to us, if you have any ideas for programmes, just please do get in touch. And so in the meantime, we'll see you next week. So thank you to our 4 guests today. And it was great to have 2 people in the studio that worked so easily. And we'll see you next week. Good night.